And I do believe that we have rotten politics, and I'm not using that as an exaggeration.
Hey everyone and welcome. In this video we're going to be having a look at the deceit, the facts that don't measure up, that the government and the NHS have been pumping out on a regular basis for months now. Before we do anything though everyone, let's have a listen to Boris himself at his last, I'd like to say briefing, but it was more like teacher telling an unruly child. Well, check this out everyone.
Good evening. The coronavirus is the biggest threat this country has faced for decades, and this country is not alone.
Is that right, Boris? What about the beast from the east winter that we had that killed 80,000? Was that not worse than this? I think it bloody was.
All over the world we're seeing the devastating impact of this invisible killer.
Yeah, and we're also seeing the impacts of incompetent governments and leaders, aren't we? Ones that are shutting everything down because of a cowardly blancmange backbone.
And so tonight, I want to update you on the latest steps we're taking to fight the disease and what you can do to help. And I want to begin by reminding you why the UK has been taking the approach that we have. Without a huge national effort to halt the growth of this virus, there will come a moment when no health service in the world could possibly cope, because there won't be enough ventilators, enough intensive care beds, enough doctors and nurses.
Let me just say it at this point, everyone. I will be discrediting that with statistics that will shatter the whole of what he's just said out of the water. On top of that, let's not forget, we did a 6-month lockdown because of saving the NHS, and they were doing TikTok videos, weren't they, because they had nothing to do. And we found out that they'd missed up to 3 million cancer screenings. I don't know how many people are going to pass because of that, but I can guarantee it'll be a larger number than the Lurger. Absolutely disgusting what this buffoon and all of his advisors and all of his people that are telling him what to do, they're all absolute buffoons.
And as we've seen elsewhere in other countries that also have fantastic healthcare systems, that is the moment of real danger. To put it simply, if too many people become seriously unwell at one time, the NHS will be unable to handle it, meaning more people are likely to die, not just from coronavirus, but from other illnesses as well.
In my opinion, bozo, you swamp fraggle, if the NHS cannot handle this, they are unfit for purpose, and why are we paying 150 billion for them to turn away people that haven't got Lurger? Answer me that one. I think we should stop the NHS personally, but let me know what you think in the comments, everyone.
So it's vital to slow the spread of the disease.
We tried that in the first lockdown and it failed, didn't it? Because then we needed another lockdown.
Because that is the way we reduce the number of people needing hospital treatment at any one time, so we can protect the NHS's ability to cope and save more lives. And that's why we've been asking people to stay at home during this pandemic. And though huge numbers are complying, and I thank you all.
Did you see the smirk he had to fight back then?
The time has now come for us all to do more. From this evening, I must give the British people a very simple instruction. You must stay at home. Because the critical thing we must do to stop the disease spreading between households
is to get rid of you and your advisors. Could it be that?
That is why people will only be allowed to leave their home for the following very limited purposes. Shopping for basic necessities as infrequently as possible. One form of exercise a day, for example, a run, walk or cycle, alone or with members of your household. Any medical need to provide care or to help a vulnerable person, and travelling to and from work, but only where this is absolutely necessary and cannot be done from home. That's all. These are the only reasons you should leave your home.
Unless, of course, you're rich, a politician or the media, then fuck it.
You should not be meeting friends. If your friends ask you to meet, you should say no. You should not be meeting family members who do not live in your home. You should not be going shopping except for essentials like food and medicine. And you should do this as little as you can. And use food delivery services where you can. If you don't follow the rules, the police will have the powers to enforce them, including through fines and dispersing gatherings. To ensure compliance with the government's instruction to stay at home, we will immediately close all shops selling non-essential goods, including clothing and electronic stores, and other premises, including libraries, playgrounds and outdoor gyms and places of worship. We'll stop all gatherings of more than 2 people in public, excluding people you live with.
Which, if you didn't figure this one out, everyone, means that the police can stop you at any moment if you're with more than 2 people. Even if you're with the family, they can stop you and ensure that you tell them and prove that they are your family. Is this not sounding more and more like Papers, Please? Who does this buffoon think he is all I can say. I do not consent to any of this. Do you?
And we'll stop all social events, including weddings, baptisms, and other ceremonies, but excluding funerals.
So all forms of fun are now outlawed, but if you die, you'll be looked after.
Parks will remain open for exercise, but gatherings will be dispersed. No Prime Minister wants to enact measures like this. I know
There's that smirk again.
the damage that this disruption is doing and will do to people's lives, to their businesses, and to their jobs. And that's why we've produced a huge and unprecedented programme of support.
So as you can see there, everyone, he's trying to make out that the NHS is 1 millimetre away from being completely swamped. So we'll have a quick look at that. Now, I've found this. This is from Nick Triggle, who is the BBC health correspondent, and it's titled "English Hospitals Emptier Than This Time Last Year." Yep, you heard that right. Even though the government and everybody else, including Labour, have been saying the numbers are going up and the admissions are going up and the people succumbing to it are going up and the hospitals are being overwhelmed and we all need to go into tier 4 and tier 3 and tier 2. Well, listen to this. The latest hospital occupancy data has been published in England. It shows in the week ending 13th of December, 89% of beds were occupied, leaving 10,500 empty beds. So that means hospitals were actually busier this time last year when 95% of beds were occupied. So at the moment we've got everybody saying that the numbers are going up and the NHS is getting swamped, whereas they are actually releasing hospital occupancy data, which says that that is not the case. In fact, they're actually less than they were this time last year before the virus was about. Now, as you can imagine, this isn't going down well with a lot of people. We all know London went into tier 4 yesterday, and we all saw the mad rush of Londoners trying to flee the city to get away from tier 4. On top of that, we've also got things like this. This is Catherine Birbelsing. She, if you don't know, is a headmistress and founder of Michaela Free Charter School, doing it differently. Freedom from state, truth on race, small c conservative. If you don't know who she is, go and check out her Twitter page. She is very, very good. And in my opinion, might be one of the best headmasters in the country at the moment. And I'm sure you'll agree. Well, she is obviously as miffed as everybody else in regards to this, and has come up with this tweet. Dear Conservatives, I have tried to understand, really I have, the pressure, the decisions, but you've now lost me. This is an utter shambles. You should be ashamed of yourselves. A joke of a government. I am done. And you've got to feel for her on those lines, haven't you? Because she's not wrong, is she? They should be ashamed of themselves. They're killing the schools and therefore our children's futures for what? 99.9% survivability rate. Now, obviously, she's been rounded on for this by the left waffer, and they've been trying to make her effectively look like a dumbass. This one being a prime example. This is from a beep. I'm not going to tell you his name or her name or their name. But what I will do is just show how idiotic these people are and how vicious they are with their idiocy. Listen to this. Okay, obviously you're not bright enough, so obviously this person thinks they are, to figure this out on your own. It's not about beds, it's about ICU beds and staff. Yes, elective surgeries are cancelled. They're not keeping non-emergency patients overnight, which leaves empty beds. The ERs are full, the ICU is full. Now, that's just glaringly stupid on so many levels. For one, hospital occupancy includes ERs and ICU beds. I'm sorry, but it does. Whether you like it or not, you're absolute buffoon. And to start off with a smear, you're obviously not bright enough, proves you've lost the argument before you've even begun. So I'll do you a favour and let you know, get off Twitter because you're not cut out for it, to be honest. Now, what's my opinion on this? I think this is absolutely disgraceful. I mean, they're telling us that the numbers are going up when the statistics and facts are proving that they're not. In regards to the tweet, one thing he did have right is they're turning surgeries away and they're turning patients away, which is increasing the number of people that have died because of Lurga and the NHS daily. And yet, people like this are so stupid that they think they have the moral ability and right to belittle someone. I think it's ridiculous. They're telling us that the numbers are going up, but the facts are stating that they're not. I mean, this is from the BBC, so it's not as if they're going to be favourable for us, are they? This is going to be biased, and even they are starting to report on the fact that the numbers don't stack up. And yet, we're still in lockdown, aren't we? What's your opinion on this, everyone? I'd like to know your opinion. This just proves that they're wrong, doesn't it? But we're still in lockdown. It also proves that they're not looking at the statistics, doesn't it? I mean, if they're saying that the hospitals are full, I mean, check this out. Remember the Nightingale hospitals? All of them are still empty as well. And yet, they're saying the NHS is swamped. It's not swamped at all, is it? Nowhere near swamped. I personally am sick of it at this point of them saying things along the lines of we've got to save the NHS. We pay the NHS to save us, not the other way round. What's the point in an NHS that won't treat you? Am I wrong on that? If you're new to the channel, don't forget to hit the like, comment, subscribe, hit the bell icon, share it out, everyone. Stay safe, and I'll see you on the next one.